Can I take just a minute to clarify one point here? About why and how socialized medicine enslaves the doctors. I want to quote from an article I wrote a few years ago called "Medicine, the Death of a Profession." In medicine, above all, the mind must be left free. Medical treatment involves countless variables and options that must be taken into account, weighed and summed up by the doctor's mind and subconscious. Your life depends on the private inner essence of the doctor's function. It depends on the input that enters his brain and on the processing such input receives from him. What is being thrust now into the equation? It is not only objective medical facts any longer. Today, in one form or another, and I was writing a few years ago, the following also has to enter that brain. The DRG administrator, in other words, the hospital or the HMO man trying to control costs. This is what the doctor has to think. This guy is going to raise hell if I operate. But the malpractice attorney down the street will have a field day if I don't. And my rival down the street, who heads the local PRO, the peer review board, favors a CAT scan in these cases. I can't afford to antagonize him. But the CON boys, the Certificate of Need boys, disagree, and they won't authorize a CAT scanner for our hospital. And besides, the FDA prohibits the drug I should be prescribing, even though it's widely used in Europe, and the IRS might not allow the patient a tax deduction for it anyhow. And I can't get a specialist's advice because the latest Medicare rules prohibit a consultation with this diagnosis. And maybe I shouldn't even take this patient, he's so sick. After all, some doctors are manipulating their slate of patients. They accept only the healthiest ones, so their average costs are coming in lower than mine, and what's going to happen to my staff privileges? Would you like your case to be treated this way? By a doctor who takes into account your objective medical needs and the contradictory, unintelligible demands of some 90 different state and federal government agencies, which is what there are. If you were a doctor, could you comply with all of it? Could you plan or work around or deal with the unknowable? But how could you not? Those agencies are real, and they are rapidly gaining total power over you and your mind and your patients. In this kind of nightmare world, if and when it takes hold fully, thought is helpless. No one can decide by rational means what to do. A doctor either obeys the loudest authority, or he tries to sneak by unnoticed, bootlegging some good health care occasionally, or, as so many of them are doing today, he simply gives up and quits the field.